Hello there, I'm Dr. Steve Tashiro. Are you frustrated, sad, and discouraged because your chronic knee pain keeps you from doing the things that makes life enjoyable, like going for walks, playing golf, playing with your grandkids, walking your dog? You don't want to take the drugs because they make you feel bad, and you don't want surgery, and yet you can't do the things you love because of your knee pain. If this is you or a loved one, take heart, because what I'm going to share with you in the next few minutes is an introduction to our non-drug, non-surgical, natural knee pain relief program. This is a 3-phase program in which we address 3 different components contributing to knee pain. Now I'm going to touch on those 3 components in this video. Let's talk about the structural aspect. When we look at the structural aspect of your knee problem, what I'm referring to is, number 1, the alignment of the joint. So just like your car needs to have proper front end alignment if the tires aren't going to wear out, all the joints in our body, including the knee, have to be in proper alignment. If the alignment is poor, then anytime you're weight bearing, there's greater wear and tear and stress, deterioration on the soft tissue structures inside the joint. By alignment, I mean the vertical alignment between the upper and lower bones of the knee. Now we assess that through x-rays, and we also look at the same time at the amount of space in the joint, the cartilage. You've heard the term bone on bone. When you have a bone on bone knee condition, that means that the cartilage is all worn out, so now the bone is rubbing on bone, and that's very painful. We have to step back and ask, if that is the case, why that developed. So that leads us again to the issue of alignment. And if the alignment is poor, we have to ask why. And that leads us to consideration of the important role of the soft tissue supportive structures. Not only the ligaments and tendons, but the muscles. So just like any joint, your knee is stabilized and moved by muscles. Now, if these muscles weaken, then the knee loses stability and motion. So in our knee assessment program, we thoroughly test all the key stabilizing muscles of the knee. The muscles in the front, the muscles in the back of the knee, as well as the muscles higher up in the hip and even the low back. If we find that these muscles are weak, we have advanced methods of treatment to rapidly turn these muscles on to stabilize the knee. If we find that your knee is out of alignment, we use chiropractic adjustments to improve the alignment. And if we find there's a loss of space in the joint, we use computerized traction in order to open up that space. So that's how we approach the structural aspect of knee pain. Now, what really sets our program apart is the fact that we also look at the neurological component of knee pain. And by this, I refer to the fact that our bodies have inbuilt systems for naturally inhibiting pain, specifically pain from the knee. Now, one of these systems consists of the nerves that come out of the spine, go down the legs, and end in the feet. If these nerves are firing properly, their signals will intercept pain signals coming into the spinal cord from the knee before those signals go up to the brain, which is when you know you have pain. So in the knee assessment, we look at the function and health of these nerves, and if we find that the function is compromised, we have therapies in the office to rebuild and repair these nerves. I'm going to draw a picture on the board here to illustrate how this works. What I've drawn here is a cross-section of the spinal cord. So if my finger's a spinal cord and we cut it like this and look down into the spinal cord, that's the view that we're looking at. This black line represents the nerve fiber that carries the pain signal from your knee into the spinal cord. That signal then is picked up by another nerve. It travels over to the other side of the spinal cord, and that same nerve carries it all the way through the brainstem, through the lower brain, the cerebellum, all the way up to the parietal lobe part of your brain, and that's when you know you have pain. So that's how pain works. Now, the system that I talked about that inhibits that pain signal consists of large diameter nerves. They're called large diameter afferents, represented by this blue line. Now, those large diameter nerves are thicker than the small pain fibers, so the signal through them has a louder volume, as it were. The signal through that large diameter nerve goes into the same area of the spinal cord as the pain signal. It then travels up through the brainstem and all the way up to the parietal lobe. But notice how I've drawn this blue line cutting across the black line representing the pain fiber. That's because in the spinal cord, the large diameter nerve sends out a shunt, you might say, that actually intercepts the pain signal coming in through the pain fiber, so that pain signal never makes it all the way up to the brain. Now, some of it does make it up to the brain, so what we're talking about is not totally eliminating your pain sensitivity. We just don't want you to have inappropriate pain awareness, which you now do. That's why you have chronic disabling knee pain. So we have therapies in the office that allow us to stimulate the activity of these nerves. One small example would be if you've ever bumped your elbow against a counter, first thing you do is you put your hand on it and you rub it. What you're doing is you're stimulating one of those large diameter nerves, the one that perceives and responds to pressure. The nerve fires, that inhibits that pain signal, and you feel better. So we use that same principle, the same pathway, in order to manage your knee pain. Now, there's another system in your body that also contributes to managing pain, and that comes from the top down. Our frontal lobes create electrical signals that travel down the spinal cord, out the spinal nerves to regulate all the organs. But another function of those signals from the frontal lobes is to intercept and inhibit the pain signals coming into the spinal cord from the knee. And these signals from the brain go down to the same area of the spinal cord where the pain signal from the knee arrives. And once in that area, those signals also intercept and inhibit the pain signals from the knee. So what I'm referring to is called brain-based therapy, and it's a method we use to assess the function and health of your brain, especially the frontal lobes. We use it to assess the health and vitality of those pain-inhibiting signals from your frontal lobe. And if we find that they're weak, we have ways of increasing their strength. It's called brain-based therapy. We use that to stimulate the frontal lobe so those pain-blocking signals get stronger. The net effect of that is decreased pain and improved function. Now, the third aspect that we look at is the metabolic side, meaning body chemistry. So if you have pain in your knee, it means that you've got inflammation there. Inflammation is like a fire that ultimately destroys tissue. We have to look at the presence of inflammation not just in your knee, but in your whole body. And we have to look at the reasons why that may be there. So I'm talking about dietary patterns. What are the sources of inflammation from diet? Well, if you're eating too many vegetable oils, omega-6s, in comparison to omega-3 from fish oil and flaxseed oil, that is highly promoting of inflammation and chronic pain. We have to look at blood sugar levels, because if those are out of balance, too high or too low, that can be a cause of inflammation. There are various other causes that we look at. We do this using questionnaires. If you have lab tests from previous healthcare visits, we encourage you to bring those in because that can be a clue about the systemic inflammation cause of your knee pain. So with our three-pronged approach, which again includes structural assessment and support, neurologic and metabolic, with this three-pronged approach, our track record is very high. We have at least 90% success rate in helping people with knee pain improve their function and decrease their pain. Now, if we only used one of these three aspects, we'd have okay results, but not great results. Patients that come to my office want the best results possible. And so when we're using these three aspects of support, that's where we get the outstanding results right there in the middle. Now, when you come in for your visit, in addition to doing the evaluation, including the x-rays and looking at all these aspects, we'll also be showing you testimonials before and after x-rays of other knee pain patients, showing you that it actually is possible to recover from knee pain without drugs and without surgery, using your body's own innate, inborn ability to heal and recuperate. So this is Dr. Steve Toshiro. I look forward to meeting you and helping to improve the quality of your life through our natural knee pain relief program.